I'm Jaleesa with CNSA, and today I'm going to be inserting an NG tube into my patient. So I would have already checked the provider's orders. Now I'm ready to come in and explain the procedure to the patient. Hello, Mr. Jones. How are you doing today? Can you give me your name and your date of birth? Okay. Hey, Mr. Jones. So I'm here. I'm going to be inserting an NG tube for you today. How do you feel about that? Do you have any questions? No? Okay, great. So, wash my hands, provide privacy, come back and raise the bed. So you want to make sure the bed is at a comfortable position. And his head of the bed is already raised. If it wasn't, I would raise the bed to a 35 to 45 degree angle. So we're gonna start by having our NG tube, and we're gonna measure it to make sure that it's placed correctly. So you're gonna measure from the nostril to the ear and bring it down and measure it. Okay, so you're gonna see where the measurement, and you're gonna take a piece of tape. But there's already tape right here. But if there wasn't, I would place tape and to indicate where I want to stop. So now that we have that measured, you're going to just take a look in his nostrils and try to see which one's the better one. So it looks like the right side is the better nostril, so that's what I'm going to be using. Take a look in his mouth. Okay, so everything looks good. I can go ahead and start. So now you're going to put on your clean gloves. So you have your clean gloves on. You take your jelly, your lubricant, and you lubricant the tube. So you're gonna lubricant about 3 inches, 3 to 4 inches. You wanna make sure you put this right here just in case. And then you have your water. So you're gonna have your patient hold the water and take sips of water. Not quite yet though. So you have your tube. Now you're ready to begin. So your tube's already lubricated. You're gonna have the patient hold his head back. You're gonna place the tube in. So you're placing the tube in, and you're gonna see the tube coming down the patient's mouth. Can you see that? It's right in there. So now that you see the tube, you're gonna have your patient start taking sips of water, and you're going to have him hold his chin to his chest and just keep inserting the tube. So with every drink of water, you're gonna insert it a little more. So take a sip, Mr. Jones. Okay, good. Keep inserting it up, and he's gagging. So when he starts gagging, you want to make sure you get your light and you take a look and make sure everything's okay and it's in the right placement. Okay, looks good. It's okay, Mr. Jones. You're just gagging. Just take another sip of water, and I'm going to continue to insert the tube. So I'm inserting the tube. He's taking sips. I'm inserting as he's taking sips. Okay. Take another sip, Mr. Jones. Okay, so you shouldn't be feeling any resistance. I'm at my mark. So what I'm gonna do now, Mr. Jones, you can stop drinking the water. How are you feeling? You're feeling fine? Okay, great. So let me just go ahead and look. Everything still looks good. So now what I'm going to do is take my NG secure tape, open it up. Okay. So when you open the tape, you want to make sure that you put it right under the nostrils like this. So it's gonna be like that, but for the video I'm gonna go ahead and just do it. So you have this little cushion part right here, and you put it right here, and then you have this, lay that flat, do the other side, lay it flat, and you secure the tape so it doesn't move. So now that you have your NG tube secure, you're gonna ask your patient, Mr. Jones, are you still feeling okay? Okay. All right, he's feeling good, and he's gonna go ahead and go to x-ray. So he's gonna stay here until he's brought down to x-ray. So now at this time, you're gonna go ahead and remove your gloves and lower your bed, and you are done. Make sure you wash your hands.